Health and Wellbeing Board on Thursday the 8th at 10 a.m. It's not a huge agenda, but it's a very important agenda, and there's probably some bits that we probably need to discuss, because I think we have 3 briefings today, so I think we will be looking to discuss about that at some point. Anyway, let's crack on. I can only see 12 people, but that's the way it is. If you need to get in, please do not hesitate. Are we live, Andrea?
We are, Chairman.
Right. Okay, apologies for absence.
I have one apology from Pam Travers.
Right. Any from the floor, as it were? Can I say? Minutes. We have the minutes of the previous meeting held on the Tuesday, 10th of September. Are these correct? And has anybody any issues that they wish to bring up that isn't on the agenda later on? I see nobody. I'll put that one to bed. Disclosure of members' interests. Anybody that isn't already in the book, as it were, and can be looked at? I see nobody. Items for discussion. Item 4, and we go to 4.1, report of the Director of Adult Social Care and Children's Services. I think I'll go straight to Liz Morgan. Liz.
Thank you very much, Chair. So obviously, since this report was written, again, there has been a significant number of changes, but I thought I'd just start by running through what the infection is looking like today in Northumberland. I think I continue to be concerned about the number of cases. We're seeing roughly 80 a day over the last week. We're still in the top 20% of local authorities in England in terms of case rates. I think I can say that other rates are increasing, other areas are increasing at a greater rate. And our local case rates over the last week have been about 171.4 per 100,000. In terms of the geography, it's still largely concentrated in the southeast, although the southeast is becoming larger. We're seeing cases popping up in Amble and Alnwick, again along that A69 corridor, as well as some of our more densely populated wards in the southeast of the county. And in terms of age, about 40% are aged 18 to 34, about 40% aged between 34 and 64, and the remaining 20% are reasonably evenly split between under 18s and over 65s. In terms of admissions, there are 50 people, I think, in the trust at the moment with a positive diagnosis of coronavirus. That doesn't mean that they've been admitted because of COVID-19. They could have been admitted for a number of other reasons, but that is 20 more people than there were on Sunday, and that probably really does reflect the levels of transmission in the community and the burden of infection in the community. We've got half a dozen people in intensive care, again, not necessarily in intensive care because of COVID-19, but it's certainly in intensive care with COVID-19. And we've, as some of you will be aware, Alnwick Hospital is closed at the moment to additional admissions because of patients with coronavirus. So it is having a significant effect across the county. Since this paper was written, the restrictions have been introduced. So these are new restrictions which were introduced on the 30th of September. Probably worth saying that those restrictions were accompanied by a request from the 7 local authorities for a significant package of support. That package of support covered a variety of areas, so financial support for the hospitality sector, support for local testing and contact tracing, support for the voluntary and community sector, care homes, comms, education and enforcement. Some of that funding is starting to filter through, and some of that funding we are still pursuing vigorously through every possible route. But I think what it has done is, I think the change in restrictions have been confusing for the public, and to be honest, we're still working our way through what the ramifications of those restrictions are, and what people can and can't do. So it is, it's the whole situation is very complex. In terms of schools, we have got a large number of schools, again largely in the southeast, which are affected. It's mostly single cases in schools, but we have got a handful of schools that have got multiple cases. In terms of the geography, again, it sort of largely reflects community transmission. So it's largely schools in the southeast, and it is again transmission. It's not transmission within schools. It is children and staff who happen to have coronavirus that they've picked up either within their own household or within the community. I think the education team and the public health team have worked really hard with schools to minimise the impact on children's education. We've had a really small number of school closures, and they've literally been closed for a day or a couple of days, and often that's just because of restrictions on staff. They just haven't had the staff to be able to keep schools running. I think we've done, we're working really hard with schools, and I think we're just conscious that there isn't a manual out there for schools to enable them to manage that. So we've had to constantly adjust practice to accommodate the situation that we're finding ourselves in. And I think also worth mentioning that schools are working very hard as well to try and keep bubbles to a minimum. And there's quite a lot of wellbeing support that is now being put in place for schools, both for teaching staff and to enable teaching staff to identify children with wellbeing issues, and also to support children themselves. So working really hard to make sure that the impact on schools and children's education is minimised. With care homes, we have got we've had a handful of cases and outbreaks in care homes over the last week. A lot of those have been identified through the whole care home testing process. So a lot of the patients that we've identified and staff are individuals who didn't have symptoms, but of course they're all being managed and supported. So we've got a very comprehensive package of wraparound support for care homes, which includes a lot of support from our infection prevention and control team in the trust, who've been absolutely fantastic at going in and supporting these care homes. In terms of businesses and workplaces, again, the public protection team has reprioritised the vast majority of its work now to support COVID-19 and businesses and to support business compliance. We've started doing proactive visits to particular areas. So the public protection team were out with Northumbria police colleagues in Ashington on Saturday, did a number of proactive visits with businesses in Ashington during the day, which were largely received, I think actually all received very positively. I think businesses felt, I think the businesses really appreciated having the opportunity to have an individual conversation with public protection staff and to get some specific advice about their particular sector. We also did some visits, or the public protection team also did some visits in the evening on Saturday. I think businesses are largely compliant, but obviously you'll be aware that one establishment in Bedlington has since been closed. The community, Northumberland Communities Together team, have also been really proactive in supporting communities. So the community hub teams are have a presence at the testing sites. So they try and identify individuals who, if they need to self-isolate, can access support, both financial and practical support, because we recognise that for some families, self-isolating either until they get a test or for the 10 days after they get a test is a real challenge on many fronts. And we've also done a pop-up event by the Northumberland Community Hub team at Manor Walks in Cramlington last week. They had about over 400 conversations with members of the public, provided people with safe packs containing face masks and hand sanitizer. I think, again, that was received really well. People appreciated getting some advice and some information about where they could get additional support. They identified a number of people who we wouldn't otherwise have identified to and sort of signposted them into support. So I think the Community Hub team is intending to roll that concept out to other towns across Northumberland. With testing, the testing rates remain quite buoyant, still over 2,000 a day. No, that must be 2,000 a week. We've got the new testing sites up and running in Blythe and Ashington, and we're working with the Department of Health to develop local testing sites in Berwick and Hexham. Those are just going through the infrastructure review process with the Department of Health at the moment. If that goes ahead, then those testing sites should be up and running within the next 3 or 4 weeks, which will, I think, provide more consistent access to testing in Hexham and Berwick and the surrounding areas, which will be really good. I think in terms of issues, I think there are issues around capacity, particularly in the public protection team and in the public health team. There's more and more of the COVID-19 response that would have been picked up by Public Health England is being pushed onto local authorities, and that's not just this local authority, that's happening across every local authority in the North East. So we are all having to think about how we prioritise what we do, and obviously the priority is responding to all of these inquiries about COVID-19, which are largely coming from workplaces, schools, and care homes and independent supported living establishments, etc., etc. I think in terms of the restrictions, it's really too early to say whether those restrictions have had an impact, but there's still plenty of work to do in terms of getting consistent and straightforward messages out about our collective responsibility. And then I think the final issue is about contact tracing. I think we've been pushing in the North East for a much more local contact tracing service. There's not been a huge amount of movement on that at the moment, but we'll still continue to push for that as our preferred option. Going back to comms, there is, the comms team have been doing a fantastic job in terms of pushing messages, both localized, targeted, out to the public. And Anne, I don't know whether you want to provide just a bit more of a detailed summary about what we're doing on the comms front.
Yeah,
Thank you, Liz. That's really helpful. Members will be aware that we, as part of our outbreak and control plan, we commissioned a communications and engagement strategy. We now have that back, and that circulated to members. And part of that was a significant stakeholder mapping exercise, and it's actually been very useful for the 5 priority settings to undertake that exercise, so we know what's working and what's not. There are toolkits prepared for each of those priority areas as well, across most advanced across the care setting, schools and with businesses now. As Liz mentioned, obviously the new restrictions across the LE7 area, there's a huge amount of activity has gone into that across using local and regional media, social media, PR, you name it, we are doing it at this point in time. Across Northumberland, we've got a postcard that will be getting delivered on doorsteps that sets out what residents can and can't do. And indeed, we've used that in our engagement work that Liz mentioned. The Northumberland Communities Together team have been undertaking initially at Manor Walks, and they use that the postcard that we developed on the what you can and can't do to help as an aid memoir, and people really welcomed that. It was really warmly received. Across the LE7, we're working very closely together with all my comms colleagues across the patch, and we have a integrated campaign underway. Many members may have heard the radio campaign that we've got underway across the patch on Metro Capital, Sun FM, etc., which is kind of focused on we're all in this together, but everyone needs to do their bit now. Again, that's been very warmly received. We've got integrated campaign across social media, Spotify for the younger age group. The messaging around that, as you'll appreciate, is different tonality, and across advertising across Facebook and Instagram as well. We're working very closely with Cabinet Office, so the Government Communications Service now. Members may have seen there was some digital ad vans in circulation a couple of weeks ago with some quite startling messages about high-risk areas. Basically, when restrictions, local restrictions are applied, that's the sort of tools that they use themselves. So we paused them because we felt that they kind of jarred somewhat with our own restrictions. We all know how difficult it is trying to communicate and simplify these messages. They may well be stood up to, again in the coming weeks as part of our overall campaign around that. We have been talking to them as well about supporting our engagement activity, with getting some boots on the ground across areas that do have high prevalence in terms of infection spread. As Liz mentioned, that may well be across the southeast, but there are other areas now as well. So we're looking at doing some engagement work around, across the southeast, Cramlington and other areas as well. Going into community spaces too, so supermarkets, and community centres where people are going to hang out, just to make sure that they've got that message loud and clear. Working with the businesses as well. As Liz said, our businesses have been phenomenal in terms of the response to this, but we do have issues in some areas, takeaways perhaps need a little bit more support with that, and our hospitality sector have worked tirelessly to put all the safety measures in place, but there has been a direction served over the last couple of days. We're looking at some advocacy as well from partners that we're working with, including the Trust, and I know Claire Riley is on the call, around getting some supportive messages from them. Some of the figures that we get from our dashboards daily, people do find those interesting, but they also question us on hospital admissions and the number of deaths in terms of what happened in the first wave and what's happening this wave. So I think it's really important that we work with partners like the Trust and with our GPs to provide that voice, trusted voice, to support our messaging. We're also working with our job centres on that advocacy message as well. We do have some money that was secured through the ask to government on those local restrictions, and collectively across the LE7 we will work commission further work to support our efforts around that, and I'm happy to take any questions.
Right. For everybody's knowledge, we've also had our hand strengthened with the return of internationally and nationally recognised chief executive back onto the team. So we've got meetings today, and hopefully we'll be back stronger than ever with that one. Councillor Watson, I can't say about 10 people, so I'll go to Councillor Watson first.
Thank you, Richard. Really, it's a follow-up question, Liz. Have we got to the bottom yet of, you know what I'm going to ask, because I can see you smiling. And for the rest of the people who are here, on Sunday, we had a query about what happens in village halls, where they're doing gym classes, dance classes, etc. I raised the query. I read the rules and regulations, and I could not understand them. I couldn't see whether it was right or whether it was wrong to have indoor sporting activity of that type more than 6. Liz was taking it up, so that's what this question's about to all the people who are on this meeting. Liz,
Liz, do you want to comment?
And I'd love to be able to give you an answer to that. We're trying to come up with a consensus across the 7 local authorities on what the regulations allow people to do. I think we're talking really about Zumba classes in community centres, and whether that can be done, whether that just has to be done as a household or a bubble, or whether you can have 6 people in a Zumba class. And I'm hoping that there will be an email in my inbox which provides a bit of clarity about that. But I think it just goes to demonstrate how complex the regulations are, and it's not just one set of regulations. We're trying to toggle between 4 different sets of regulations to work out what is allowed and what isn't allowed, and I suspect that there have been some unintended consequences from some of the restrictions that have been put in place because of the speed at which the legislation has been written.
Thank you, Liz. It's bigger than just community centres, of course, because now that I'm looking after Active, it actually could mean Active having to close down all its leisure centres if we can't, and that would be a disaster, I think, for health and well-being. But we have to do what we have to do. So I'll just please let us know as soon as we can.
Yes, I will do.
I'm going to go to Councillor Guy Renner Thompson. There's a number I can't see. So we'll go to Guy, and then I would imagine I've got others I can't see who want to be in.
Thank you, Chairman. There's a lot of speculation in the press today, and I'm getting queries from residents about this 3-tier system and further restrictions in the north. I think just for the benefit of the people watching, do we have any official communication about that?
No, I don't. I'm hoping that we will be in whichever tier does not impose additional restrictions.
Right. I think things are changing as we sit. There's an announcement now. On the ones I can see, I can't see anybody indicating to speak, but I would imagine Susan. Yeah, I imagine I've got that. Susan, come in.
Thank you. How well you know me. First of all, thank you for welcoming back our chief exec, and I agree with you. We've got to be in a better place with Daljeet back where she should be. Thank you as well, Liz. I think the pop-ups, your work with the community hub is a really good idea. Just being in communities, talking to people while they're out and about, rather than it being around testing. Although I think the idea that we've put in that extra support for people waiting to get tested is a good idea as well. The 2 earlier speakers to some extent have covered what I wanted to say. I have concerns about community centres, and I may be coming from a slightly different place than Jeff, because I have concerns about the fact that activities are still happening there, and I'm not convinced they're always safe, and they're attracting vulnerable age ranges as well, I would suggest. But like you, Liz, I have spent the past 3 weeks going over guidance the legislation, looking at companies' house in terms of what they have to do, and I am none the wiser. I'm really not, and I think it's open to interpretation as you choose to interpret it, and that's really dangerous, because if you want something to carry on, you can find the grounds to allow that to happen, and conversely the same. So really would welcome some clarity on that, so that we can pass that on to communities, because it does feel, when I mean the figures in my ward are going down again now, thankfully, but you know, when those figures were rising, it seemed a bit of a nonsense that older people were meeting to do Zumba in an enclosed space, for instance. And I think they are different to leisure centres, where we have the greater capacity to put in those COVID secure measures. And I'm not suggesting our community centres aren't. I just question some of the things happening in them. And I would welcome, like everybody else, clarity quickly over whether we're going to be included. I get the feeling now that the cities, the northern cities, are working to a slightly different agenda than the regions. So it's shifted slightly, because the numbers around cities are significantly different than they are around other areas. But I know that you will give us clarity as soon as you get it, if we ever get it. Thank you.
Can I just say that before Liz comes in, Jeff, you obviously wearing the active hat. Can you share that information? Because I think it's across all of our county. If we're talking about our county, the use of village halls for yoga, Zumba, all that. And while it has got a fantastic offering, if it's not safe, we've got to take action. Liz, do you want to come in on any of that?
No, I mean, I think clearly, as soon as we do get some a line to take that we're content with about physical activity, we'll obviously communicate that out. Okay, I think I've got David Thompson want to come in.
Thank you. Just about contact tracing, Liz, you mentioned the efforts you're making to have more local control, which is not just in Northumberland, seems to be national. I sense from what you say that is a very, very significant issue, and should more local control come in, then things might be more positive in terms of reducing the infections. Is that a fair comment or not? And do you think we will get more local control?
I think collectively, I think nearly every local authority is pushing to have a more localised contact tracing process. At the moment, the only offer is something called enhanced contact tracing. So that involves local authorities being given a line list of individuals that NHS Test and Trace have not been able to contact within 24 hours. And then the local authority then takes on responsibility for doing that contact tracing, or contacting the cases. Actually, the actual contact tracing process is escalated back up to the national test and trace process. But actually, and that would have been manageable a few months ago when the number of cases were small, because that offer to do local contact tracing doesn't come with any additional resources apart from training in how to use the CTAS system, which is the contact tracing and advice service system. So I think our view is that we can't take up that offer, because we don't think we've got the capacity to be able to deliver it in any consistent way. Actually, what our preferred option would be to have some of that national resource that's currently sitting in tier 2, what's called tier 2 of the NHS NHS test and trace processes. These are the sort of clinical call handlers. We prefer to see some of those individuals reallocated to support a regional or local contact tracing process. Still using the same system, but actually just delivered and supported by individuals who know the ground that we're operating on, and can more readily identify connections and links between individuals' workplaces and geography, which I think the national system is less able to pick up.
Okay, right. I do have a lot that I cannot see. Anybody there shout out?
Ralph?
Ralph? Rafe? Where are you? Can't see it. As soon as you speak, you'll appear on my screen. Mute, unmute. I can get... Rafe, are you there?
Yeah. But my question is about support for people in care homes. Is there any guidance or any examples of good practice that can be disseminated around the issue of people in care homes who've got dementia? And we know that they're suffering greatly from the lack of stimulus of seeing people. So is there anything that's been able to be done to assist care homes with those people who are so isolated?
Who wants to come?
Richard, do you want me to ask that? It's Kath.
Yeah, I'm seeing.
Yeah, okay. This is obviously an area that we are constantly looking at and endeavouring to work with our care homes on a regular basis to see whether or not there is anything that we can do to assist in this area. Some of our care homes are providing some really innovative and interesting ways of providing a stimulus really to some of our most significantly challenging patients, but it does remain an area that we are obviously constantly reviewing.
Okay. Anybody else?
So the answer to that is no.
Rafe, do you want to come back?
Well, yes, I can see the complexity in that, but it doesn't sound like there is anything. The other question I have is, how do we identify the cost on other areas from the concentration on COVID? I'm thinking here about the people with long-term conditions, the cancer detection and early work. How is that picked up, and how is that recorded so that people aren't being lost?
Okay, who's going to pick that one?
Can I come in on that, Chair, please?
Yeah. Can anybody that's spoken please turn your mics off? I'm looking at David Thompson, Ralph Earth.
Hello.
Right.
For those who don't know me, it's Graham Sires. I'm GP in ANIC. I'm clinical chair of the CCG. We monitor the progress against sort of normal business. So we keep an eye on what's happening with the wait times for cancer. It's a challenge at the minute to keep all the normal services running. The cancer services have actually done pretty well. We're working hard at the minute. Dermatology is one of the areas where there's been slightly higher wait times. We have put lots of communications out through general practice around, please remember to come and see us if you've got symptoms suggestive of cancer. We know that there were late presentations, but we've been pushing hard to try and get people to come forwards. Long-term conditions, we got behind. So you can imagine everybody with a long-term condition generally gets an annual check at their surgery, but we had to suspend all that for a couple of months when we were in the depths of the initial pandemic. All the surgeries have reignited those annual checks, but they are behind to a degree, and they're all working hard to try and catch up. What's happening just now is that we're being slowed down again, because we have had some practices that have had staff off. We've had issues with the continuity planning. All the practices are talking about what their plans would be should they fall short of staff on certain days, and the CCG does a daily sit rep finding out what's going on with all the practices, and we've got systems in place to try and make sure nobody goes short. But there is that crucial thing about when do you go back to purely emergency cover, and how long can you keep going with some of this routine stuff? And that is the big challenge that we've got. We have fortnightly meetings with Northumbria Hospital looking at all the waiting times for things like hip operations, reigniting all of those services. Northumbria have done very well to get onto that fairly quickly. They are operating. I think there's somebody from Northumbria on the call, and they may wish to come in on that. But we are monitoring it. But it's not easy given what's just going on at the minute. Mental health. I do just want to mention that Liz mentioned mental health. It is coming to the fore at the minute. I believe, I haven't got all the details, but I've heard we've had some more suicides in Northumberland over the last week, and we will be looking into the reasons around that. But certainly there's an awful lot of mental health issues going on. I see it personally in general practice. Interestingly, teachers were mentioned already on this call, and I think they are under particular pressure at the minute.
Okay, right. Anybody else? If I can't see you, speak up now before we move on. I can't see anybody. Liz Ann, do you want to touch on duplication? I have had a conversation with Susan on email about, I think there's 3 briefings today. So I think we probably need to have a discussion at some point of the duplication that is now sort of racked up. Councillor Dunworth?
Yeah, I agree with you. I think it's come to a head today because everything's fallen on the same day. But I think our communications as an authority are much better than they were at the beginning, obviously, because it takes a bit of time to work out. I am going to struggle to get up to all 3 of those meetings today, actually, because I do have other work to do as well. And I'm aware it's the same things, but I'm particularly aware of the pressure it's putting on our communications team, on Liz, on the executive team. Actually, we all know these meetings take time, so I am more than happy to look at other ways of doing it. And I think you were talking about rolling in the communications and engagement group back into this. That could be done certainly the weeks that this committee meets. Maybe we still need to do the meeting on the other week because it's every fortnight, isn't it? But I'm more than happy to look at ways of reducing the workload for officers so they can concentrate on what they need to be doing rather than telling me the same thing 3 times.
Okay, Liz.
So the issue really is about the member-led comms and engagement subgroup, because a lot of the individuals who go to that, you know, we have a discussion about comms and engagement and our, obviously, you know, the strategy and what we're going to be doing in the ensuing weeks. But actually, a lot of the people who've been to that meeting will have had that same briefing a number of times, and we're sort of coming to the conclusion that actually that's not the best way of doing it, and that perhaps the comms and engagement subgroup should be held immediately after the Health and Wellbeing Board, so that we can have those discussions then, rather than having a separate group where you'll probably hear the same presentation that Anne has just given for those of us who go to both groups. So Anne and I and the chair thought that rolling the comms and engagement subgroup into a meeting immediately after the Health and Wellbeing Board might be just a way of rationalising the number of meetings that we have about comms and engagement.
Okay, I think I've got a thumbs up from Jeffrey Watson. I think common sense may prevail on this one, and I'm sure if we keep everybody informed, we'll find a path forward. Anne?
Yeah, just to come in on that, thank you for your support with that. I think things are moving at such pace as well. I think you know, we're standing up various different campaigns, growing campaigns, different kinds of activity, and people are hearing things multiple times as well, which I don't think is helpful for anyone. It's not a good use of anyone's time. But what I might suggest is that, from a member's point of view anyway, is that we do regular member briefings too. So perhaps we do a little bit more detail on comms and engagement within that, just to give reassurance to elected members. We have a first of our virtual weekly meetings for all elected members as well. Perhaps we put the comms and engagement update as part of that in the weeks going forward, which might help just keep everyone up to date and provide that reassurance that's needed.
Okay, right. Before I move to urgent business, I would just like to also welcome on this call, I can't see him, was an acting leader, now he's actually leader of the council, Councillor Glenn Sanderson. So Glenn, I can see you on here, so welcome. Urgent business, I have none. Anybody? I can see David Thompson. You need to unmute. Unmute, please. I can't. David, you need to unmute. Ah, dear.
That's it. Sorry it took so long. Richard, just moving beyond the pandemic,
Yeah.
and I fully understand and appreciate that everyone's attention is directed, towards dealing with that major problem which we all face. But knowing this committee talks about many other strategic issues, which obviously are on the back burner, and understandably so. But we can't leave many of these strategic issues on the back burner indefinitely. Has any thought been given to not necessarily when we may resume talking about these strategic matters, but what the order of batting might be? What are the most important ones which we need to get back to, sooner rather than later, if at all possible? But within that, I fully understand everyone's attention is being directed towards dealing with the pandemic, but these strategic issues, we cannot ignore them indefinitely.
Okay, we did discuss yesterday. Liz, unmute, yeah.
So yeah, David, I completely agree with you, and I meant to put the forward plan on the agenda and omitted to do so. So that's entirely my fault. I think there are some things which which do have to come through the Health and Wellbeing Board. So I know that Paula Mead is has been doing some work on the mental health JTI. That's probably something that we need to consider as part of a wider consideration about mental health. I know that Siobhan wants to bring the population health management a report back to the Health and Wellbeing Board. So yeah, we do need to sit down and identify those things that absolutely do have to come back to the board, and be a bit more systematic about how we do that.
Okay, right. It's in the pipeline, David. We are aware, but as I say, we're fighting fires.
I understand that.
Right. Urgent business, I have none. Date of next meeting will be held on the 12th of November, and we'll obviously have some communication over how we do the comms and the subcommittees, etc., in a more streamlined way. Okay, thank you everybody for your attention, and it's not a bad time. We'll see you all wherever.